I got a question from one of my viewers that asked this question, that if I am HIV negative and my wife is HIV positive, is it possible for my baby to be HIV positive, or what is the status of my child? Yes, you're welcome to this channel once again, and don't forget to subscribe if you are just coming across our video for the very first time. Then if you are still with us, thank you for coming back. Don't forget to like, share and comment your question under the comment section, and we'll give you answers to every question that you ask to the best of our ability and to the best that you are going to understand. If a husband status is positive or is negative, and the wife status, or let's assume if the husband is negative as he has said and the wife status is positive to HIV, what will be the fate of the baby? That is a question that we are here to answer. Yes, a baby, it can actually be the baby in the under intrauterine, or the baby you've delivered, or the baby you are breastfeeding. The only way that a woman can actually transmit this infection or this virus to the baby can either through breastfeeding. Yes, that's through lactating or through lactation. When you give birth as a woman, when you give birth to a bouncing baby boy or a bouncing baby girl, whichever of it, through breastfeeding, there is high tendency that you can do mother to child transfusion. Breast milk or during lactation, there's tendency that this virus can get to the baby once they breastfeed or once they breastfeed from you. Then another way is during delivery. If at all guidelines are not being followed while you are doing your delivery, there is tendency of mother to child transmission of human immunodeficiency virus. That is, HIV can actually transmitted from the mother to the child if at all the delivery it is not done under the guidelines or the procedures that it's supposed to be done. So that is why it is very essential that you as a woman, after you've confirmed yourself or you've known your status and you know you are positive, make sure you know the kind of hospital you are using so that they will be able to ask them, do you know how to do delivery, or how you can actually get my baby out of my womb without getting infected. The high chances of the baby getting infected is actually very high, but there are ways or procedures you can actually take in which you have your safer delivery. So it can actually be through delivery. Then if at all you are a woman or the wife, and the only way you can also transmit this HIV to your child is maybe after you might have used a sharp object, and the sharp object is used by your toddler or your baby. So in this way, your baby become infected because the sharps like razor blade or clippers or anything that you've used, and it is already contaminated with this infection. If at all the same material or same sharp object has been used or is used by your child, there is every high chances of them getting infected because there is still presence of that virus in that object that was contaminated. Then another way is if at all their mother's blood is being transfused to the baby. For instance, now maybe the baby is anemic after delivery, or fine, the baby needs blood to be taken. If the mother's blood is being taken and they transfuse it into the baby become infected. So mother to child transfusion, it can come in this form. That's either through breastfeeding, the mother is actually breastfeeding the child, the baby is at risk of getting infected. That during intrauterine life, maybe during delivery, the baby can also get infected. Then the use of sharps by the babies that has already been contaminated by the mother. That's the mother that is HIV positive now. She made use of sharp object that cuts her and is contaminated, and the baby carried the razor blade, the knife or anything and use and cut him again or her, he or she may become infected. Then if at all the blood of the mother is being transfused to the baby, the mother is now the donor and the baby is the recipient, and the mother is already HIV positive, there's also high tendency that HIV is being transmitted from the mother to the child. HIV's precaution is very, very, very important that we all should know. Avoid sexual intercourse with somebody living with HIV and AIDS without protection. So meaning whenever you are having sexual intercourse with them, always make sure you are on protection. Then you that have been confirmed seropositive, that if you are confirmed with HIV, always make sure you make use of your object once and discard, once and use. Make sure if you are placed on treatment already, make sure you are always regular with your ART. Talk to your healthcare provider. HIV is not a disease. It is not something that you should attach stigma to, and don't let people to stigmatize you. We are here for you. Always communicate with us and we give you the best advice. Don't forget to subscribe to my channel, like our video, comment and share your questions. Share it to everyone that you know they will definitely benefit from this video. Till we meet again in our next video. Don't forget, I make videos on the signs and symptoms of people living, women or men living with HIV. Go there back to the channel and watch them, and you will enjoy the rest of your day. Thank you.